The Rome trial evaluated whether treatment selected by a molecular tumor board based on genomic profiling could improve outcomes compared to standard of care. Between November 2020 and August 2023, we screened 1,794 patients with comprehensive genomic profiling performed on both tissue and liquid biopsies. 400 patients with druggable mutations were then randomized to either standard of care or targeted therapy. The study met its primary endpoint with a significant improvement in objective response rate. We have 17% in the targeted therapy group versus 9.5% in the standard of care group with a p-value of 0.026. The median progression-free survival was also extended from 2.8 months with standard care to 3.7 months with targeted treatment. In particular, the 12-month progression-free survival rate tripled from 7% with standard care to 22% with targeted therapy. And at the AACR Congress 2025, we presented an exploratory analysis examining how concordance between tissue and liquid biopsies affected treatment outcomes. Among the 400 randomized patients, 197, 49%, had the same actionable alteration in both their tissue and liquid biopsies. In these concordant cases, targeted therapy showed remarkable benefits. Median progression-free survival reached 4.9 months with targeted treatment versus 2.8 months with standard care, translating to a 45% reduction in progression or death risk. The 12-month progression-free survival rate was 27.2% with targeted therapy compared to just 9.1% with standard care. Overall survival also showed improvement with a 12-month survival rates of 47.8% versus 38.8%, even if not reaching statistical significance. These findings demonstrate that when both tissue and liquid biopsies identify the same actionable alteration, patients derive maximum benefit from precision medicine approaches. This concordance identifies patients most likely to respond to targeted therapies, supporting the integration of dual biopsy modality in clinical decision-making for advanced cancer treatment.